I was asked if we do this again, can we please precede it with a golf tournament? And
Yes.
that sounds good. If anybody here has happened to notice this little lapel pin I have, I put that on today because a patient gave it to me. It says Screen Actors Guild. I've been made an honorary member of the Screen Actors Guild. And I've also been told if I appear in any more ads, I have to start paying dues to the guild. I have a better response than that. It is my pleasure to welcome all you here, and we're going to start this off with a video. And I think this video by itself will tell us a lot about why we're here tonight and who the person we're here to honor.
Assembled up these physicians, John a cardiologist, and here I am as a surgeon.
Their mother insisted when they were very young that they were both going to be doctors. She wouldn't let them do any shop. They couldn't work with a saw or an axe.
Mother always worried that I'd hurt my hands. Didn't want to go to high school and college, which I promptly ignored. Yeah, I've been very fortunate. I've got two families melded into one. Everybody gets along really well.
He's a great father.
He's a tremendous role model.
He would always make a point of being there.
Without fail, somebody would say, "Are you Dr. Frazier's son?" I would say, "Yes, yes." And, "Oh, your father saved my life. Your father is the nicest man in the world." He pretty much walks on water. Not really, but almost.
It was love at first round of golf.
No, I think you ought to give him more shots.
I'm a better player, but he always seems to win the money.
Occasionally I'll sneak in and win $1 or $2. Yeah.
Because he has 10 strokes.
I'm a little embarrassed. She's only giving me 10. You know, she's been playing so well.
Tom Frazier is not handy around the house.
I wouldn't say I'm a bad handyman.
For instance, he stuck a screwdriver in a light switch last winter and blew all the fuses in our apartment.
Oh, that was, electric is not my
That was the problem originally was a blown out light bulb.
I was a little embarrassed.
He actually sews more than I do.
He mentioned to me that the convertible portion of his Porsche had been broken into and they sliced the top. He told me that he fixed it, sewed it up himself.
I can sew pretty well. That's how I make my living.
I was in awe of this job he did. It looked professionally done.
He's a master with a needle and a thread.
And he looked at me and said, "Well, that's why I'm a surgeon."
I've known Tom since medical school, and we were residents together, and during residency we got exposed to plastic surgery.
When I finished my general surgery training, I went to a great hospital in Houston called MD Anderson.
I could see that he could relate to his patients on a different level.
I will tell you that Tom Frazier is the best communicator of patient surgically that I have ever seen in my career. That's what makes him the best.
That's why he connects so well with the women he treats.
What we said is, why should not women have their breasts reconstructed when they had their mastectomies? And we challenged it from Bryn Mawr Hospital, and it's now the standard of care for breast cancer patients.
Tom's vision was to provide care all in one setting and having physicians interact between the different specialties because we made one another better.
Well, the Comprehensive Breast Center has been open for over 4 years now, and it's Dr. Frazier's vision.
Been very fortunate to be in a wonderful place to live and work, and I'm particularly grateful to Bryn Mawr and the support the community has given to our breast center. It's just been magnificent.
5 years ago, having an abnormal mammogram, my diagnosis was a tumor in my left breast.
And I remember feeling I was upstairs in my bedroom and the walls just seemed to come in on me and the air seemed to suck out of the room.
So it was basically 10 or 12 days from the time I first saw Dr. Frazier that my chemotherapy started.
When I had my first chemotherapy treatment, they told me in 2 weeks you'll start losing your hair because of the drug adriamycin that I had had.
And we went into his office and he had a yellow pad, a legal pad, and he drew pictures. He draws a picture of your breast and talks about where the cancer is, and then all of your options, and with each option, you know, what could have possibly happened. And I said, I think it's time. And within a month, I had lost my breast. When I was in the hospital for my actual surgery, the nurses and the staff over there were wonderful. I was in the pre-op room, and he stood behind me, wheeling me into this surgery room, and never lost eye contact with me, till I went to sleep. My name is Kathy Brennan, and I am a 7-year breast cancer survivor, and I've known Dr. Frazier for this entire 7 years.
To be special, you have to have a connection with your patients. I think he's got the ability to connect with almost everybody.
In general, getting people well is really a partnership. Practice has really worked pretty much as a team for many years.
Dr. Frazier is a fantastic recipient for this award.
He has clearly had an impact on clinical research regionally and nationally in terms of taking his patients, their data, and helping answer questions that are far bigger than any of us can answer in one little practice.
He genuinely cares about people. He's intelligent.
He takes that one step further and further and further to give you that comfortable feeling that he's there for you at all times.
I think this is really more an award for all of us that are taking care of people with breast cancer here at Bryn Mawr.
Jerry is going to say a few, or how about Emma?
Tom, I'm honored I can be here. Congratulations.
All right, very good. Andy, can you top that? Here we have Dr. Rohr.
Well, you know, allergy and breast cancer don't cross paths too many of them, but really Tom's a heck of a nice guy. He always says hello.
All right, thank you. Anything?
I'm new to the area, but I've only heard great things about you, Tom.
All right, thank you. Thank you. Bob, could you say a few words on video for Tom?
Tom, congratulations. It's an honor, well deserved, and we have appreciated your skills in person, as a friend and mentor for our careers here. Thank you.
All right, thank you. Anyone else there? Okay, thank you. Tony, would you like to say something to Tom?
Well, I brought a few acrimonious remarks, but maybe I'll skip them. I did want to say one thing, though, about the economy and how bad it is. I just heard on the news that women are starting to marry for love again. And of course, Debbie's birthday is this week. She told me she wants me to take her someplace